She's obviously in a great deal of pain, so we had to cancel the doctor's appointment. We're not going to be going.
Y'all know I strive to be positive. That's not always the case, and that's okay. Good Thursday morning, everyone. There you are, looking cute. Alrighty, I spent 40... Is that a good headrest for you, pup? Well, I spent 40 minutes in these. Now I'm going to take them off, do the rest of my PT exercises, take a break, and then I will update y'all on what we are doing today. So today I am seeing a doctor to look into one last diagnostic test for something called MALS, or median arcuate ligament syndrome. Now, what is that and do I have it? So first of all, MALS is where a ligament in the abdominal area compresses the celiac artery, and it can lead to a variety of symptoms. Everyone's affected differently, but kind of the main symptom my doctor is aware of is pain, specifically after eating, and it kind of manifests itself in GI symptoms. It honestly seems like this complicated issue, but that's kind of the brief gist of it. To correct this problem, and I don't know if I want to say correct because even after surgery people can have complications, but there is a surgery you can do to release the ligament and hopefully resolve some of these issues, if not all of them. But none of my doctors are knowledgeable enough in MALS to say, yes, you need the surgery, not even my surgeon, because there are not an abundance of surgeons who are experienced enough to properly do the surgery. In fact, a lot of people end up going out of state to get the surgery done. But my POTS doctor has had a handful of patients with this problem, so he knows the testing to order to at least get things started. So back at the beginning of 2017, when I was having my GI issues get worse, he sent me for a duplex ultrasound, and it came back normal. However, apparently I was supposed to do it with inhalation and expiration and laying down and sitting up. So I went back and did it again with that criteria, and it showed a 70% compression of my celiac artery and high velocities, which is indicative of MALS. Then again in 2017, I was inpatient for something, and that same doctor ordered a CT scan with contrast, and that came back completely normal, no compression. So I had a positive and a negative ultrasound and a negative CT scan, and at that point a lot was going on with my health, and we just didn't feel like looking into something that didn't show much promise for helping my health, and we decided to put a pause on it. That is until a few weeks ago when I saw my POTS doctor and we decided to pick things up again. So the next test I'm doing is called a celiac plexus block, and it's done by a pain management doctor. I already have a PM doctor I love, but he doesn't do this specific block. I guess it's kind of special, and all I know about it is that it is outpatient, and if I get relief from it, it's pretty indicative that I have MALS, and it'll be worth talking to a knowledgeable vascular surgeon. I haven't gotten that far, though I do know of one in Orlando who's doing these surgeries now, and he was trained by Dr. Cherry. But in all honesty, my testing has been so inconsistent. There's been ups and downs on this journey. Like first it was, yeah, I do have it, and no, now I don't. There's no compression on this testing, and some people have the anatomy for MALS but no symptoms for it. Surgery may not help. I personally feel like I don't have the textbook symptoms for MALS, and I don't think I am a candidate for surgery, but as my own biggest health advocate, I feel like this celiac plexus block is at least worth looking into, especially with the potential of improving my GI symptoms. So all we're doing today is talking to the doctor.
Well, several hours has passed in between Jack's last click and now, and she's obviously in a great deal of pain, so we had to cancel the doctor's appointment. We're not going to be going all the way up there. It's probably for the best. It's an hour away, and plus an hour and a half sitting there. If you don't know late doctor appointments, or you're usually not going to be seen right away, so and then an hour back.
I'm just so mad.
Jack's a little bit upset.
I'm like trying to do this stuff for my health, and then my health gets in the way. And I started off today well, and now I'm hurting so much, and I don't like, is it the AFO is hurting me, or is it IVIG, or is it like just my body being uncooperative? I don't even know, and I'm just so pissed off right now.
So we're gonna go relax inside. Hopefully Jack will feel better. Well, Jack is inside. I set her up with her heating pad and some cheese and crackers, and she's already looking and feeling a whole lot better. Now she realized that the trip to the doctor's appointment, which was like an hour and a half away, would be way too much on her. And her seeing her in the car in great deals of pain was no bueno. I'm in my pickup truck. I'm gonna go get this thing washed because it has been a solid minute since I've got this thing washed. So it's covered in pollen and all sorts of other things. I think the big thing for Jack today is to realize to take a deep breath, take a step back, and you know that the hour and a half car ride, or the hour car ride to the doctor's appointment, and you know, hour and a half sitting there in a doctor's appointment. If you've never had a late afternoon doctor's appointment, it's a nightmare. First in the morning is always the best to get because you're in and out. You know, you see the doctor first thing and your appointment lasts no longer than 30 minutes and you're out the door, and then you know you're there for like an hour max. Late afternoon doctor's appointment, everybody knows doctors get behind schedule, and you know it's like a 2-hour process once you get there. So it would have been 2 hours of driving plus 2 hours. It would have been like 4 hours of her just being in constant pain and seeing her in the car and, you know, uncomfortable and everything. It was just it was not working. So I made the call to cancel the doctor's appointment and just go home and relax. She's currently enjoying her afternoon watching a comedy show. She hasn't picked one yet. It's either gonna be The Office or Parks and Rec. In the car wash, and you can't really tell, but thanks to this thing being so wide and having a solid front axle, it took me like 5 tries getting it in here, and this thing barely fits in this car wash. But I like it. They do a really good job of washing cars. So either hand wash it, which I hate hand washing cars. It's a nightmare. Oh, look at it. Nice and clean. It barely fits. Look how close everything is to this. Oh, don't lose my windshield wipers.
Judd is back. Did you get your truck cleaned?
It's nice and washed.
I'm feeling better.
Yeah. More relaxed.
Yeah, it was the right call. I mean, this isn't where I want to be, but it's where I need to be. And sometimes the pain just gets so bad, I can't think straight. And I was just frustrated. I mean, y'all know I strive to be positive and logical, but that's not always the case, and that's okay. Thank you, my voice of reason over here. He said he has this good saying, if you can't change your situation, change your attitude. And I mean, I was grumpy.
You were.
But I'm doing better. Thank you, babe.
You're welcome. That's what I'm here for.
Something smells yummy.
Potatoes cooking.
Put the baked potatoes in the oven. It's gonna be good.
Mm-hmm. Jack's helping get dinner ready.
I didn't do anything.
Well, you made the potatoes earlier today. The potatoes are almost done. The steak was cooked in this old cast iron skillet that we got from her dad. The chicken was cooked in a regular old pan, and we're gonna go outside. You can follow the smells. I'll smell for you guys because you guys can't smell because it's on camera. But it smells delicious. Anyway, this is an old Weber grill. Best way to cook it. On there, the steaks are pretty much done when they come out to the grill, and you just throw them on the last little bit to get that charcoal-y flavor. And those are portobello mushrooms. Now, my dad taught me a way to cook portobello mushrooms on the grill. You just put up tons of butter in them, and basically, when the butter melts, it's done. So, and so that's coming along nicely. Dinner is served. Jack probably has a little bit too much food on her
He
plate.
gave me a whole potato. And I had a snack today, so I don't even know if I can really eat. It smells very good though, babe. You did a great job. Usually I'm the one who cooks, but Judd cooked
I did.
tonight.
Somebody needs some snuggles. Somebody needs a bath. That's what you need. Well, we are nice and comfy in bed now.
I'm gonna play, well, I might play But I'll probably watch Jug play some Red Dead Redemption. And the second one comes out this year.
It does, later this year.
Yeah, I've been waiting a while for that.
Since like 2009.
Yeah, and maybe a movie, but we're just happy to be relaxing in bed.
Mm-hmm. Anyway, that's our day, and
So,
thanks for joining us on our
on our
adventure.
adventure. Stop plugging my face.